and welcome to the Wellness. I am holistic health coach and your host, Candy Nicholas, and it is my distinct pleasure and honor to have my guest for today, who is the island's Chief Medical Officer, Dr. Sharon Belmar George. She's been so accommodating and so sweet, and I'm so stoked to have her here with us because we want to get a general idea of what's going on in our collective health situation as a country, and who best to give us an idea of what that looks like than Dr. Belmar. So thank you so much again for being here. I appreciate you taking time out of what I know is a really busy schedule.
Thank you so much. It's my pleasure to be here. I'm always willing and able to provide updated information to the public on health matters.
On health, okay, so I want to ask you about your lovely lipstick. Okay, so for someone who's seeing you for the first time and wondering who this lady is, someone who doesn't know who you are, maybe a child who's just coming to understand certain things. Who are you? What do you do? And why do you do it?
Well, I'm Sharon. I'm the daughter, one of 5 siblings of my parents, born in St. Lucia, true St. Lucian, I believe, with a passion for health. I have 2 kids, a 15-year-old twin that I'm obsessed with. In terms of what I do, my passion when I'm not at work, it's at home. I'm very much into my home and my house upkeep and my garden. So basically that's what I do in my free time.
And as the island's Chief Medical Officer, what is your role? How does your role benefit us as a country?
Well, my role as a Chief Medical Officer, I'm the Principal Technical Officer at the Ministry of Health. So I'm involved in supporting policy direction, also providing strategic direction for the ministry, also the implementation of the health priorities, and also I sit on many of the health-related statutory boards and commissions as well. I also provide oversight to the primary care and also the public health heads, and also clinical oversight to the medical and nursing teams.
And does that translate to what also goes on in private healthcare? So if I go to a private doctor, a private hospital, how big or influential are you in that sphere?
Well, the Chief Medical Officer is technical clinical support for the entire country. So it's not just public sector, it's the entire country.
Okay, so that falls under your purview as well?
Yes, it does.
Okay, so speaking of what falls under your purview, what is our situation, as succinctly as you can describe it? And, we'll start there and then go into more specific areas. But what does our health situation look like? Me as a layperson looking in from the outside, I feel like it doesn't look that good from what I'm seeing, the diseases that I'm hearing people have, the things that I'm hearing people die of. I've been making the point that in the past, if you heard some, it was rare to hear that someone had cancer. I'm not saying it didn't exist, but it was a rare thing. Now you hear someone has cancer, it's like, it's like hearing someone has a cold. So from your perspective and having all of the information and statistics that you do and dealing with, all of the statutory bodies around health and all of that, what is, from your vantage point, what is our health situation looking like as a country?
So for St. Lucia, if I have to give you an assessment of the health system, we have to look at everything from the beginning, because we have to use data to guide what we do and also how we do it. So we need, in doing an assessment, you have to look at who you're providing the health services for. So although we're a small island with a population of supposedly a little over 180,000, our health system is divided into 8 health regions. The health regions are all very different, even if we're a small island. As you're aware, we have different districts. For example, when you're providing care and to plan and implement a program, you need to look at what are the numbers that you're looking at. So our biggest district is, for example, Castries, that makes up about 30% of the population, followed by Gros-Islet, which provides about 15%, Vieux Fort 10%, Micoud 9%, and the smallest community is probably Canaries, if just a little over 1%. So the numbers already gives you an idea of who you're catering for. Then we look at what we call the morbidity profile. What do the persons within those health districts suffer from? And this is something we do and we use to plan, because the illnesses we may see for example, ancillary would be different to what we see in Vieux Fort or Castries or ancillary. So your health system has to be built around the population that you serve, to know which services you provide more of or less of, and where do you put your specialized services. So within that network of our country, we look at what people get sick from. And I'll speak a little bit of what we're seeing more of, what are the changes that we are seeing over the years in terms of our morbidity and mortality profile. So as you're aware, we have a network of 33 wellness centers, 2 district hospitals, a polyclinic. We have 2 hospitals which are statutorized, and a private hospital within the country. We've done an assessment of the health system, and on a very general note, I will give you some ideas of what are the strengths that we see in the health system, what are the weaknesses, and I'll go into some of the diseases that we note and what the strategic direction in terms of improving our health situation to improve access, improve quality of care. So on a general note, some of the strengths include the fact that there's political will to improve the health situation. If you notice, the government is looking at the universal health coverage, but in a phased approach. So this is a plus. As we know, less than 20% of the population is covered by health insurance, and the cost of medical care is quite high for most families when they get sick. Such a small percentage is covered with health insurance that most persons, when they get sick, it's out of pocket. They have to take a loan, family has to support, and especially major illness is very expensive. Our comprehensive network of wellness centers around the island is a huge plus, and there's access close to the various communities. Also, the fact that we have a state-of-the-art hospital, which is the Owen King EU Hospital, which was opened a few years ago. We have fair, dedicated, well-trained human resources, and we have a lot of relationships with our international partners, like World Pediatric Project, Sick Kids, Martinique, Cuba, Kids Inside, the Queen's Jubilee Fund, and I can go on. We have a lot of agencies that we have good networks with.
And how does that benefit us?
It benefits us because as a small island, even given our numbers, the cost of providing care and providing that service for a very small number may be exorbitant. So a lot of our services we provide based on the number of persons who need care. Now, we are not accepting that those services are not available here. We are working towards improving and increasing the number of services that are available on island, because we know it's a complaint we get when people have to travel overseas for certain diagnostics and certain services because it's not available here. We build in capacity through these networks because they do a lot of training for our staff, especially at the hospitals.
So training.
Which we got. For example, the last mission that we had this year with the US mission, a lot of training was done at the level of the hospitals for the surgeons. And they also gave us equipment so that some of the services that they would come in to do, we would now have it available on island. And this is one of the things which we try to do every time we have a linkage or we engage one of those missions. We try not just for them to come do it or to send people out, but we try to build capacity in country. We also have a lot of international and regional support. And that's a lot of technical support which we get from the Pan American Health Organization, the Caribbean Public Health Agency as well, OECS, all of these organizations working with us at the ministry to improve on what we do continuously. We're also one of the few islands, I should say, with a health management information system that allows us to get patient data in a very timely manner coming in, so that no matter which wellness center that you go to, they can access your information even if you were at a different wellness center. So that's within the primary care, the community center. We also have a strong epidemiology unit where we get our data analyzed, which is what we use for planning and also for implementation. And one of the benefits which we got from managing COVID was our strengthened public health system, our labs, our ports, our surveillance, and even diagnostics. I will also give you some of the weaknesses which you hear more of and some of the challenges that we face within the health sector. The deficit of human resources. Big time our nursing situation, where a lot of our nurses migrate and go overseas. We have a huge nursing shortage within every level of care, and it's St. Lucia.
I had no idea, but that would make sense because there are such great incentives to go. I guess these other countries have nursing shortages as well, and they offer such attractive packages to too.
And it's very difficult for us to try to match what the nurses receive overseas. So even if we train, but a lot of the nurses, especially our senior nurses, have left for better opportunities overseas. We see that in also pharmacy, which is getting worse by the day. A lot of our pharmacists are moving to the private sector. So some of our facilities, we have to be sharing the pharmacy sometimes during the day, like half day and another half. So this is another area. And also from some of our medical specialties where we have shortages. So this is one of the areas that
what
is
are
a
these areas,
challenge.
in case there's someone watching who's trying to decide with their child what areas they should study? So what is
like endocrinology, for example, is
Okay.
one of the areas that
because I know only one endocrinologist. Yeah.
yeah, that we have neonatology, for example. We don't have any neonatologists on islands, and some of the more specialized surgical areas that we don't have, and even some of our numbers for the specialties, when persons retire, in terms of replacing them, that can also be a challenge. You find for some of those more specialized cases, those persons have to go overseas for care. The lack of having a complete universal healthcare system, we know the government is doing it in a phased approach, but it's still not there yet. So it's still very expensive for the public when they have to access care for a wide range of services. It has to be out of pocket, sometimes take a loan, as I believe less than 20% actually has health insurance to be able to manage. The burden of disease that we have with chronic non-communicable disease remains a huge challenge. For us, 82% of our deaths are due to chronic non-communicable diseases, diabetes, high blood pressure, and I will go through some of the
huge.
stats.
I had no idea it was that high.
Yes, it's as high as 82% of our deaths are due to chronic non-communicable diseases.
So preventable enough diseases.
Yes, so I can probably speak a little bit about what we're seeing with the burden of disease. And when we look at the mortality, I'll do it, I can probably do it by sex since it's a little bit different.
Mm-hmm.
For males, malignant neoplasms, and the most common would be prostate cancer. Cardiovascular diseases is second, heart disease, diabetes, and all of these fall into chronic non-communicable diseases.
So we're going in order of their
right.
prevalence.
So
okay.
Cancer is number one for men.
Especially prostate.
Especially prostate. Mm-hmm. Cardiovascular diseases, heart diseases, diabetes. And following this, which is of concern to us, is chronic lower respiratory diseases, which we are seeing mostly in men, and it's related to the habit of smoking. We've seen the increases in COPD, mm-hmm. chronic obstructive pulmonary disease. We actually had to create a program for it's a lot of young males who started smoking at a very early stage. We had an issue where a lot of them were oxygen dependent and were taking up hospital beds just because they need oxygen. So we've created a program under medical assistance where we provide oxygen concentrators at home. So it's you plug it in, it uses the oxygen of the air and water, and then so they're able to get oxygen while at home instead of being managed at the hospital just because they're oxygen dependent. And this is of grave concern to us. I will speak about our behavior risk factor survey where we looked at the various risk factors. I'll also have a little discussion on that and the data that we got out of that when we compare the two surveys in time. Mm-hmm. The other area which is creeping higher up is assault due to injuries and violence. And this is mainly in our young males. So we're getting increased hospitalizations, increased deaths, which I think we hear it every day on the news. So it shouldn't be. So these are creeping up much higher as a cause for hospitalizations, for illness, for disability, and also for death. And then we have our hypertensive diseases, pneumonias, and others. But that's what's happening with our men of health concern. For our females, it's also malignant neoplasms.
So cancer.
Top ones, breast cancer, followed by cervical cancer. The others are all NCD related as well. Cerebrovascular disease, heart disease, diabetes, hypertension. So it's the chronic diseases and cancer responsible for the majority of those deaths that we are seeing. If I am to take a little closer look at the cancers, which the number one cause of death. One of the things I just want to alert that we are seeing in our data, when we compare the top 5 cancers that we see from 2019, it remains prostate for men and breast for women, but we are seeing skin cancers coming up.
Really?
We are seeing, so in our 2023 data, for males, malignant neoplasm of the prostate was the highest for 2023, followed by breast cancer, followed by cervical cancer, and fourth was skin cancer, then followed by colon cancer. So if you notice, whenever we're doing education for our outdoor events, we always indicate the use of sunscreen, exposure, direct exposure to the sun. So skin cancer is creeping up into the top 5 causes of cancer
What are we doing differently?
seeing.
What do you think? I mean, I'm sure it has to be studied more scientifically, but
Yeah.
what do you think could be contributing to that, so we know what we need to do to mitigate against that?
I think there's this assumption that because we're Black people, we don't need to protect ourselves from the sun, that it's only white people who need to, and this is false. The rays of the sun, that we need to protect our skin, especially during the hours of 10 to 2, the direct sunlight for extended period of times without the necessary protection, without putting a hat, without putting a cap, in the most cases responsible for a lot of the skin cancers that's what we think, that we are noting. So the burden of disease that we are managing is one of the weaknesses that we are seeing, because it increases the numbers at the clinics, the cost, the services that we need to provide, and the complications from those chronic non-communicable diseases that I spoke of. We have a burden of persons with a waiting list for dialysis, for example.
Yeah, so that is still, I know that has been the case for years. So I guess I just assumed that, we'd put things in place to help with that situation. So it's still a dire situation.
It is still a dire situation for persons on. And I will explain a little bit what we are seeing in our data, why we seem to be moving in the wrong direction when it comes to the risk factors. I can probably go into it now.
I was speaking with the island's chief nephrologist one time, and she was saying there are people who would turn up at her office and already have stage 4 renal disease and not know. So I guess I'm just baffled, because I know the body speaks in symptoms. I know that you don't just wake up one day with stage 4 renal disease. So it has me wondering what we're doing and what we're not doing that would lead to, it getting to that stage. And we, how do you not know? And this is not me placing blame. This is just me wondering, have we gotten accustomed to feeling imbalances in our bodies to the point that we could be so ill and not know it? Like, what are we doing to contribute? Is it diet? Is it...
It's a multitude of factors. And the important thing with chronic non-communicable diseases, a lot of them are preventable. They're lifestyle diseases. So they're related to what we do and how we do it and what we don't do. So one of the things we do, because the Ministry of Health, we use a lot of our data in planning. We do what is called a behavior risk factor survey, or what we also call a STEP survey. We did one in 2012, and we repeated it in 2019, 2020. And what the survey captures is our risk factors. And those are the risk factors that lead to NCDs. So we looked at things like diet. So how many persons get at least 5 servings of vegetables and salads? And sadly, less people eat healthy as compared. When we compare our 2012 data to 2019, a very low proportion of the population is actually eating healthy. So most persons don't get the 5 servings of fruit and vegetables a day. It's as high as 81.7 for men and 84.3. So these are the numbers of persons who do not eat healthily.
So I know it's a small difference, but I'm shocked that more men eat healthy. So what you're saying here, more men eat healthier. Men are eating healthier than women.
So for us, we got, our data was, it was higher, showing people are not eating healthy, and it's gotten worse when we compare 2012 to 2019, 2020. And also the salt intake for us is way over generally. So we already know that this is one of those things that's working against us. Physical activity was another risk factor that was mentioned, or physical inactivity. And what we noted, the prevalence of individuals with insufficient physical inactivity, 17.1% in 2019, with 13.9% among men and 19.5% among women. So that we note. And men are spending less time in physical activity as compared to men when we compare the data from 2012 to 2019. So we're doing less exercise, we're eating badly. The other risk factor that we compared was tobacco use. And this remains of concern to us because the data is showing that we're starting earlier. And there is a trend now for women much earlier. Usually tobacco use was seen more as a male thing. We're seeing it more in younger females. Although we have over the last few years put in certain programs and policies to reduce the impact of tobacco. One of those was we ratified the Framework Convention on Tobacco Control. That was in 2005. That came into place in 2006. They've also put in the tax of 63% on tobacco products.
And has that helped? Or do people just think, I need my cigarettes, I'm going to have to spend a little more for it? That's, annoying and irritating, but I want it, so I'll buy the cigarettes anyway.
The other thing was our public health smoking control regulations of 2020 that prohibited smoking in enclosed places, such as workplaces, public transportation, government buildings, etc. Because a secondhand smoke is also having an effect on persons' health. So we've done a few things to reduce the impact, but we still have a lot more to go because we see smoking starting a lot earlier, and the impact of this on the health and well-being from the lungs. Not only are we seeing the chronic obstructive pulmonary disease where persons become oxygen dependent at a very young age, but on development, on brain development, especially in persons under 18 years. So the other big one is the alcohol consumption. And St. Lucia still leads as one of the highest in the region when it comes to alcohol consumption.
I knew we were bad. I didn't realize
that.
Yeah,
we're leading.
I know someone who owns a bar. Or two I'm from Soufrière, and I'm walking around one morning because I go walking on most mornings, and I decided to walk through town. So I stopped by. I'm like, it's 7:00 in the morning. Why are you open? She goes, girl, do you know how many people need to stop for a drink on their way to work? A drink or two and I was shocked. And then I had another conversation with another medical professional. He's a urologist, and he was telling me about a lot of the issues our men are having that are directly related to the alcohol consumption or the level of alcohol consumption.
And we're seeing it earlier. And also women have also joined the bandwagon. So a lot of the problems that we were seeing mainly with male drinkers, we're now getting it with females as well in terms of the alcohol use and abuse. So, and these are just a few. I highlighted the main
diet,
ones.
lack of physical activity, alcohol consumption, tobacco
use as well is another one of them. And there are others because the mental health is another issue. The levels of stress that we are under, lack of sleep. Most persons are managing quite a bit all at once. So all of this is affecting what the health system now has to absorb as end stage factors. Some of the other issues that are weaknesses in the system that I will also explain, the gap between the human resources and the needs of the population, because we hear it when persons try to access care, the wait time, we may be out of stuff, something may not be working. Going for a service and not getting it is one of the things that we listen to from the population. The other area that we see as a gap is a disconnect that exists between our hospitals and our community facilities. Sometimes somebody is discharged from the hospital, they're given a referral note, and they may not go to the wellness center for follow-up until it's too late. And this leads to an increased number of persons being hospitalized. Whereas if our two health systems spoke directly in the community, you would see if I'm at the Miku Wellness Center and one of my residents is discharged, I'll see it directly to know this person is supposed to come in for whether it be dressing or for follow-up or for review. So if they don't come, I can call them up. This is one of the areas that we definitely need to strengthen so that when somebody is discharged from the hospital, they can get follow-up care directly into the community.
And that follow-up care, I suppose, will determine how well they recover or
Right.
from or prevent stuff in the future. Guys, we're overdue for a break. I got carried away because this has been so informative thus far. Thank you for sticking with us, and thank you for coming back on the other side of the break. This is The Wellness with Candy Nicholas. We'll be right back. And welcome back to The Wellness. I'm so delighted that you've chosen to join me today. We are being joined by the island's chief medical officer. If you don't know her name, you must have been living under a rock. Her name is Dr. Sharon Belmar George. And we've been talking about our health situation here in St. Lucia and going into great detail about that. I've learned so much, and I'm sure you have too. But if you're just joining us, there's so much more to learn. So thank you again for being here, Dr. Belmar George. So, you've given me quite a picture of what our health situation looks like and what your department or the Ministry of Health is doing to deal with that. We've spoken about some of the things that we're doing, which are leading to our not so positive health outlook on the island. So what are we going to touch on now? What are we going to put a spotlight on now?
Given that I've described more or less where we are in terms of the strengths of our health system and the weaknesses, I can speak a little bit about the strategic direction as to where we are going based on our assessment. I think, as most people know, that the government is working towards universal health coverage, which would allow persons affordable health care and accessible health care. This is definitely the way to go, because the cost of healthcare is exorbitant for most persons, given our population. A lot of persons are not covered with health insurance. One of the areas of priority for me is the quality management system for health. We get a lot of complaints on many different levels. It might be the equipment, it might be the results in diagnostics. And within our system, we register and license health practitioners, but not their practices. So this is one of the things that, for me, needs to be a main focus, ensuring that there's standardized care for all health services. And this is not just doctors' offices, it's everything related to health. So it would cover public and private clinics, diagnostic services, labs as well, both allied health services. So there must be a basic standard that every practice would need to abide by, both in terms of the clinical protocols and the equipment within the practices has to meet a minimum standard for service. This is one of the areas that's not well regulated on Ireland, and this is one of the areas which we need to focus on to ensure that there is an objective standard for health care. Our data that we saw from the Behavior Risk Factor Survey points to the need for primary care services. Now, I think when a lot of people think of medicine, they think that the Ministry of Health is conventional medicine. They don't, some people, I don't know if they don't know, but in terms of accessing primary care, most of our services and clinics are primary care clinics. We changed the name of our wellness center some years about, well, our health centers. They were health centers. We changed them to wellness centers to focus on the wellness aspect. So you don't need to be sick.
Yes, so I've wondered about that because I see the word wellness popping up in all kinds of areas these days where it wasn't before. And as someone who is a wellness advocate and holistic health coach, I'm like, how much is wellness factoring into this, or is it just a buzzword that makes sense?
No, it's not. The most cost-effective strategy that you can use is prevention.
Yes.
And with our network of services, this is what we do. You do not need to get sick to go to the wellness center closest to you. We do screening on any day you go in. The nurse will take your blood pressure, check your blood sugar. If you need a discussion on breast health, on prostate health, we have nutritionists within those services. We have our health educators. We do a lot of what we do. The majority of what we do is wellness. For example, for antenatal care, for postnatal care, our reproductive health clinics, our dental services, where we do cleanings for prevention as well. We do counseling.
You can get a dental
You can get cleanings at the wellness center.
Really?
Yes, it's available. So a lot of the public, and we see it mostly in men, people wait until they get sick to now go into a medical clinic which may have a whole crowd of people working. This is really not the strategy for health. You should be going in for a checkup even if you are feeling well. Don't wait until you've developed high blood pressure, because this is called a silent killer as well. Do not wait until you feel sick to visit one of the clinics. Go have a discussion with one of the healthcare providers about what you should be doing, how you should be doing it. Let them check your BMI, check your weight, check your waist circumference. Let the nutritionist speak to you, give you advice on what you should be eating, given whatever condition you have. So there is primary prevention, which is persons who have no illnesses, you feel well, you just go regularly. You get your breast checked, you get screening done, and that we do at the range of wellness centers across the country. And this is one of the strengths of our system, that it's located within the community. So we don't get enough use of our preventative services. People wait until they get sick to now try to access a medical clinic, which we also provide. And I think this is a myth that the population also has between conventional medicine and alternative medicine. It's not supposed to be separate.
Yeah, it's not supposed to be one or the other.
So
they can work hand in hand.
Right. There is value of both the alternative, the foods that we eat, the fresh herbs. This is the best thing that you can do to eat healthily. Use your herbs. Medication should only be used when it cannot be resolved with diet and exercise and rest and reduce stress. There are certain, for example, if your blood pressure is just borderline, a lot of persons can manage this with just their diet, proper exercise, reduce stress, rest, obesity, losing some weight, because usually as you gain weight, your blood pressure tends to go up. Drinking a lot of water instead of soft drinks, sodas, alcohol, cut out the alcohol, the smoking and all, or occasional alcohol. All right, this is what we would advocate. A lot of it can be done by a change in the lifestyle, and this is actually what we would prescribe first. This is the first part of it. But conventional medicine, the role of conventional medicine, for example, if the high blood pressure is too high, you need to add drugs, because what would happen then is end organ damage. If your blood pressure remains elevated for an extended period of time, it would now damage your kidneys. You end up with secondary complications such as kidney failure and on dialysis, heart disease as well. You get organ damage, you get a lot of secondary issues. In the case of diabetics, this is when you end up with amputations. Your eyesight gets affected as well. A lot of you get vascular issues in terms of your circulation. So the fact that here I notice it's like two different zones. It's not. You can, for example, seeing one patient, treat them with your conventional drugs, but still refer them for homeopathy, for acupuncture, and for herbal medicine as well, for massage, for relaxation, it needs to be not conventional, alternative, separate, but more complementary, similar to what's happening with integrative medicine, where they combine the two to give you holistic care. You don't treat a disease, you treat a patient with a disease. So and the importance of listening, because sometimes a headache may not need Panadol. When you actually listen to your patient and you hear what may be causing them to get the headache in the first place, a lifestyle change may end up solving the issue. So it's important to manage your patients in a very holistic way. And at the Ministry of Health, we do know the importance of alternative medicines. And we know that there is medicinal value in a lot of the herbs that are being used. But we always say it has to be used with care. So you need to know what you give to manage a symptom. So there are times when you feel nauseous and a ginger tea, or you have a stomach upset. The ginger tea would work instead of Gravol, and that's fine. Right? You need to know when a massage is what is required for your body aches and pains, which is similar to what they use to rub, and depending on what you're having. But you also need to know sometimes a swelling may be because of a fracture. Right?
So then you would need Western medicine, allopathic medicine.
So, and you also need to know if you're having an infection and it's a bacterial infection, you need the antibiotic. The herb will not cure a bacterial infection. So you need to know when it's a mild, because when my kids get sick with a viral infection, I don't one time go and give them meds. No. You know when to give the honey and lime. You know when to give you have to know when it's a symptom that you're managing. But when you're trying to cure a disease or manage a chronic ailment, you also need to know when you need to use the conventional medication. The other drawback with a lot of the herbs is that it's difficult to dose them. Every herb person has a different dose, where you put 3 leaves, 5 leaves, you boil it for 2 minutes, you boil it for 5 minutes, you drink 2 teaspoons or you drink 5. Every leaf is different. The conventional meds is actually dosed, so you know exactly how much of the drug is in the dosage. And also some of the herbs have other side effects within the plant. When you take the whole leaf, you're getting the active ingredient, but you're also getting everything else that may be in the leaf. So it's difficult to dose the herb medication. So that is why we are normally cautious, and some of them used in excess may also cause kidney and liver failure. Some of the herbs, if it's not used correctly. So it's important, and I always believe that we say to patients, I'm not saying that it must only be conventional medicine with the tablets, like they call it, but we need to know when we use both. And for me to understand that, I actually did acupuncture, herb medicine, and massage, so that I can get a full view of how to care and to manage persons. And that myth that doctors don't like herbs, a lot of our drugs are actually derived from the herbs, so we know what the medicinal value may be. But what we guide against, and we see it in the emergency room, where patients stop their medication and take only herbs, and they end up with heart disease, they end up with strokes. And we've seen deaths from persons who've just stopped their medication to take only herbs and end up with complications.
Yeah, no, and as much as I try to live a natural lifestyle and, only use medications when absolutely necessary, which thankfully, knock on wood, has not been that often in the last few years of my life, it's important. A doctor friend of mine was telling me the story. She's an OBGYN, and she was telling me the story about this patient who had fibroids. So, of course, her stomach was extremely distended, and she was left for dead by her children because they thought she had stomach cancer or ovarian cancer, and somebody asked them to, please take your mom into the doctor. And turns out that she had fibroids. She just needed to have the fibroids removed, and she is thriving and wonderful now. So we do need our doctors, people. We need them. The way I have a great relationship with all of my doctors, but they know that I'm coming so that I have a scientific perspective on what's going on in my body or in my daughter's body. And if it's something that, as you're saying, can be managed through the methods that I use, I do that. And if it's something that I need their intervention for, then I do that. So how do you see moving forward, or in the future, how do you see conventional medicine and herbal medicine having a stronger marriage here in this country? Because we know we love our herbal medicine here. We go and rub, we love our tabak jab and all of these herbal things that we use. I just had a family member who got into an unfortunate accident, and one of the first things was, we need to send this up and send that up, our la boule de masse and all, and all of that stuff. But do you see an opportunity to create a way for our conventional or indigenous medicine to work even more closely with our conventional medicine?
I think there is, and there is definitely a need, because what we're doing is isolating our patients and them not understanding that we need to treat a holistic patient. It's not a disease that we're treating, we're treating a person. So it's a lot of education that has to happen. And it's also not fair, I should say, to the patients when they're told, stop your medication and take something else which will not cure or manage a chronic condition. And we have seen that quite commonly happening. So it's education on both parts, where both the practitioners and the patients are very clear on what is the role of herbal medicines, what is the role of alternative medicine, and guiding your patients that, yes, you can do both. Because I look at something like ginger, which has blood thinning, anti-clotting properties. Many times at the maternity ward, the nurses actually have to guide the patients and say, you're going to do a C-section or you're going to do surgery, please avoid ginger. Ginger is one of those they give after persons give birth. And because they pass and they keep bleeding, they think, I'm getting rid of all these old substances. But when your body is healing, it actually clots and produces substances to prevent the excess bleeding. So yes, ginger has a place.
Ginger is not a good idea.
Right, close to surgery, or if you're having bleeding, you shouldn't be taking in high levels of ginger. And
or even turmeric. Yeah, because there was a time I was, very diligent about taking my turmeric capsules, and I'm like, why am I bruising all over? Because I'm not one who bruises, and I'm like, oh my God, it's the turmeric, I'm thin in my blood. So I would walk past the table and get a bruise.
So it's important that we know when to use what, to use it appropriately, what can help with certain symptoms. And the key to healthy living is eating healthily, ensuring that you exercise, reduce your alcohol intake. There's no positive benefit to smoking. There's no health benefits to any smoked product. There's no health benefit.
And even with the vapes, which we see getting more and more popular, because people believe, oh, I'm not smoking, I'm vaping, so that's better. But
no,
I've read that it's not.
It's not.
Yeah.
There's no health benefit in a smoked product. All right? There's no health benefit in a smoked product. It needs to stop. So and the other big part, which I think is a gap in our system that we need to strengthen, is the mental health aspect. We don't, and I say we because I'm guilty of it, we don't pay attention to our mental health and taking the time out, taking the breather, not working as long hours. The mental health, the stresses of the daily life, because we feel we need to do everything and manage everything.
Is there anything at the Ministry of any program that comes under your purview that will help not just educate people, but help support people, help medicate people where necessary when it comes to issues around mental health? Because this is what I find, and I've told this story publicly many times. So I was about 18 or 19. I was having issues with figuring out certain things in my life. I decided to see psychologist. Hi, Dr. Edgecombe. And next thing I knew, and that was quite a few years ago, but next thing I knew, I'm aging myself here, but yeah, that was a few years ago. Next thing I knew, it was, oh, she's crazy. She's going to psych. So I know that has changed a lot because everybody's, talking about therapy these days and trauma and all of that, but that wasn't always the case. Yeah. Talking about going to therapy was a very taboo topic, but that's gotten better, thank God. but we also still have a lot of issues around.
Yes.
We've come a long way, but we still have a long way to go.
Yes.
So if I say, oh, I need a little mental health break, or oh, I'm overwhelmed, so I'm taking a break from answering calls or whatever, it's, oh, no, you have to be, you know, there's all this toxic positivity. Oh, no, you'll be okay. You have to be strong. Just do da. So are there any things within the ministry that help with education, support, or otherwise around mental health issues?
So unfortunately, in the Caribbean, there's a lot of stigma attached to mental health that prevents or reduces the population from accessing or getting professional mental health care when they need it, because you branded as crazy. Although every single person at some point within their lifestyle goes through anxiety or depression, and this is part of mental health. It's not the psychosis where you become uncontrollable, or the bipolar disorders. Anxiety and depression, they're also part, which we all go through at some point in our life when we're trying to manage one crisis or another. And because of that, especially with our men, people tend not to access professional care from psychologists or psychiatrists. So we have a community mental health program, which was only 3 teams for 5 health regions, which we know is not adequate. And we also have the mental health institution within the Millennium Heights Medical Complex. Psychiatrists, that's one of the areas that we need more of. We need to have more local psychiatrists. I would love to have a psychiatrist come and lead mental health, whether it be within the ministry or otherwise. This is one of the areas where we have a gap, and it's one of the areas that we definitely need to strengthen within. We saw the impact of COVID on the population. We saw how a lot of persons who probably even before did not, especially with some of the economic downfall that happened as well, and just the daily routine of life, right? From having to manage kids. I'm managing teenagers, and I'm praying every day that
I'm managing one, you're managing twins. I don't know how you did it around the same
managing teenagers. I'm praying for God's guidance every day. I'm managing a family, managing a home, trying to manage a whole health system. It's a lot.
Yeah.
And you try to do it while keeping sane and keeping in one piece, and it's a lot. And everybody within their sector, they have a story of the stresses that they have to manage with limited resources. Mm-hmm. So it is an extremely aspect of health that we have to also take into consideration.
Yeah, we're due for a quick break, but we will be right back. This is The Wellness with Candy Nicholas. Welcome back to The Wellness. My name is Candy Nicholas, and we're wrapping up what has been an amazing discussion, but we've nowhere scratched the surface. I mean, yes, we have scratched the surface, but there's a lot deeper that we can go, and I hope she'll come back. Dr. Sharon Belmar, she's the island's Chief Medical Officer. So as we wrap up, I want to touch on a few things that we have not had the time to touch on. You came under a lot of fire for suggesting that we have more children, and it was like, but you know, we laugh about it and we joke about it, but a decline in birth rate is not something that any country wants. And from what I've read, about two-thirds of the countries in the world have a decline in birth rate. What are some of the negative things that can happen down the line if our birth rate continues to decline in the way that it is? And we'll put up some slides to show you. It's very visible from a quick glance at the slides what's been happening with our birth rate. So less people are having children, more people are waiting until later to have children.
Correct.
What trouble could we be in?
I did say it on the lighter side, but it is a serious issue. When we look at our population pyramid over the last 10 years, we had initially a progressive pyramid where our numbers were increasing due to births. Right now, we have a regressive one. So we're not replacing ourselves. Our population percentages is about 0.6%. So it's less than 1. And we've seen it in the school system where there are new classes and there are no kids.
What?
The early classes, yeah. They're not enough stage 1s and Ks.
Wow.
Because the numbers are just very low. So we have very few young people. People are now living younger because the life expectancy is more. So we have an aging population. So it means every single ministry and agency and sector needs to be planning for implementation of programs towards an aging population. And I think it was very progressive to include for us in the ministry elderly care. We have to start thinking elderly because this is who we are managing more of. We are having less children. We are seeing people living longer. So a lot of the illnesses, a lot of the conditions, a lot of what every sector needs to be thinking of is managing elderly care. Now, there are a few things which I spoke of earlier, which is of grave concern to me. We are making less babies. What is the quality of those babies coming out? Given our ladies now, what we are seeing increase in women smoking, drinking, less healthy lifestyles. Right? So I'm also concerned about the quality of conception that we are going to have. As women, a lot of us having careers, I'm also guilty. We wait until the last minute to have kids. The new generation's thinking is a lot different. They commit a lot less. Young persons, they tend to, the new generation, they commit to, and it's not just when it comes to families and kids, it's also jobs. It's just a new way of thinking. They move on quickly. If something is not working, they move on. They don't waste time like us that sit and work on things.
Your panties up.
So a lot of them are progressive. They get into other activities. They move on to opportunities. And most persons are having kids a lot later. So it means now the working population is less. So we have to think of the economics of how are we supporting that older generation that now has more illnesses, more ailments, needs specialized conditions. Generally in the Caribbean, people tend to spend less on elderly care and elderly patients. So we have geriatric services. We have very few. We don't have any geriatric physicians in St. Lucia. So people don't specialize in geriatric care.
I didn't even realize that was a specialty, but that would make sense. So you know what we're going to do for people, for those who may want to go into medicine? I'm going to get a list from you and put it up so people can see what areas of specialty we need. Okay,
so this is something which the country as a whole, because it's not just the health sector that needs the plan, but every service need to be thinking of the population and the implementation of plans as we move forward in the years, because our data is showing us where we are heading in the next 10 years.
Wow. Okay. And I know one of the things that the ministry has done is provide certain services for free.
To 80 years and older for elderly care, because those persons are not working. A lot of the times they're dependent on family members. So healthcare and medication and all of that is provided free of charge under the Golden 80 Plus program.
Okay, and then for pregnant women, so what are some of the incentives? So what has the ministry done to make me think, oh, maybe I should have another child before I close the shop?
One of the things we noted was we would get persons with complications coming in to deliver. Our antenatal services, and I will say it again, persons who are pregnant, you can come free of charge for all of your antenatal services. Go to the wellness center closest to you. This is free of charge. What we had noted was the diagnostics was expensive and some persons would not do it until they come in. So your blood tests, your ultrasounds, those are now free of charge. So it means our pregnant women should be living healthier lifestyles. The products of conception, that is our neonates, our babies, should be healthier because they're getting full care from the reviews within the wellness center, the tests that need to be done, the blood tests, the ultrasounds. All of this is done free of charge. So there's no excuse in terms of persons not having financing to ensure that they have a safe pregnancy.
And then one more thing I want to touch on, speaking about, actually in the graphs, before we move on to another topic, before we wrap up, I saw something about fertility, which looks like our fertility situation is not looking so good.
Well, the fertility rate is also going down, and it is relating to persons not making kids, not having children.
Okay. All right. So, okay, I thought we were less healthy. So
no. A lot of women are deciding that they'll not have kids or just have one.
Okay.
So we're seeing more and more of that every year.
Okay. All right. Oh, I think as a woman, I'm thinking that's smart on one hand and thinking that's smart, but I'm also thinking obviously that's not good for our long-term situation as a country. And what is the situation of STIs? Especially in this very happy, jolly season that we're in right now, what is the situation with STIs as we wrap up? Especially HIV. When I was growing up, every other ad on television was about, taking precautions against STIs, especially HIV. What does that look like now?
Well, HIV, we presently have about 1,000 persons in care for HIV. HIV has become a chronic illness because they're very good drugs, that's the antiretrovirals, which we provide to our patients free of charge within the community. So most of our patients, once you're compliant, we're able to bring your viral load, that is the percentage of the virus within your blood, very low. So when the viral load is very low, persons are healthy, they look healthy, they're able to live, work, and live normal lives. So it's no longer the picture of someone with HIV going into AIDS where you're very sick. Our HIV patients have become similar to patients with chronic illnesses. You take your medication, you remain well. We have clinics across the island where we manage HIV. STIs, we continue to see increases, and those increases are sadly usually after our masquerade events, typically for Carnival. So
this is not a myth. There's literally a direct correlation between Carnival.
Yes, we do.
And
yes, we do.
An increased rate of STIs.
We get the increases in the clinics.
Oh, wow.
So if people think that it's no longer there, we have a wide range of STIs circulating in countries. So we really want the public to take the necessary precautions. We give off condoms to all of the Carnival bands, and those who don't have, it's available. We also give condoms free of charge within the communities. So it's important for us to prevent sexual health is extremely important. There are some that you can cure, and there are some such as HIV that remain as chronic diseases. So it's extremely important that we also take care of our sexual health.
Okay, well, on that note, we have to wrap up. I want to thank you once again for taking the time out to do this with us today and to tell you that you have an open invitation. I will be harassing you so we can continue these discussions, because there's so much more that we can touch on so that we have a great idea of what's happening with the health situation here in St. Lucia. And thank you for all that you're doing for our healthcare system and each of us by extension, because we all make up our healthcare situation here in St. Lucia. And thank you for joining us. This has been The Wellness with Candy Nicholas. I'll see you next week, same time, same place. Bye.